Good morning, everybody. I have to apologize ahead of time because I'm super nervous, so don't judge me too harshly. But good morning to all of you. As she mentioned, my name is Aldece Ramos. I'm an executive board member for ASME Local 2712, a union that represents social workers amongst other disciplines. I myself am a social worker. I currently work at Twin Towers Correctional Facility, working with the mental health population there. I'd like to start off by thanking Dr. Katz, Dr. Galley, Dr. Lee, Teddy McKenna, our president, and the health agency in general, all of you here today, for allowing me to speak on behalf of my colleagues. I'm hoping to be able to share one of many perspectives, as we've seen today, about this integration process, how it's going, and kind of what it looks like from this end. So Twin Towers is the first jail health site to integrate the Sheriff's Health Services and mental health together under one health agency and one leadership team. And it really has felt like the goal has been to bring things together in a manner which makes the access and disbursement of these services much more cohesive and unified. For those that aren't too familiar with the jail system, there are a number of departments and programs that serve our mental health population there, including mental health, medical, we have religious services, school services, substance abuse counselors, sheriff's departments. It's a big group of people trying to move that machine. And although we do our best to try to work together and deliver these services in an organized fashion, as you can imagine with any large, big system, sometimes there's a few delays, setbacks, things don't always run smoothly. But we're seeing and feeling that things will be different moving forward, that they can be different. So I know, again, one of the goals of the agency is to streamline as many services as possible and bring things together under one umbrella, as opposed to having various different departments working independent of each other. In the last few months, there's been a definite push to develop treatment teams to provide a better level of care, which sounds kind of basic, but we weren't really doing that so well before. So these teams are comprised of mental health clinicians, among them social workers like myself, part of 2712, who are assigned to work with inmates one-on-one, also psychiatrists, nurses, jail linkage staff that help with release planning. I mean, a group of people really coming together to provide these services in a more united front. And so as we come together to serve this population, we want to improve our line of communication, not just between each other, but with the people that we're serving. We're hoping that this community approach will make a difference in how people are served and how people feel about the services that they're getting, and that they don't feel disposable or irrelevant, or that they're being ping-ponged among various staff and groups of people, that their services are consistent, that they're collaborative. And so with this integration and team model, we really want the population to feel a more united sense of support with everything. I also know that in conversations that I've been present for with Dr. Katz and Dr. Galley, that there's a big push on reducing the waiting period for these services. That's a really big deal, and it's something that we're really striving to be better at. Trying to provide faster access to care and just being able to be more efficient with our time. So in order to help meet many of these goals that the facility and the health agency has, there's a big push to hire more staff, which is always great.
Woohoo! I love to hear that.
From the jail perspective, from the labor perspective, we really want to get more people in to help meet these needs, right? Because we can't do everything with a small group of people. Like we really need the help. And so, although we have a ways to go still with how things go in practice, the preparation and the rolling out phase with all of this, as I said before, is definitely being done with the intent to provide services more effectively and efficiently. And of course, another big, huge goal is to reduce the recidivism rate, which I know one of the other line staff mentioned for the jails, and to just be able to provide treatment and rehabilitation, not just while they're in jail and during their incarceration, but to do a better job of preparing them for when they get out, when they go back into the community, so that we can link them and integrate them in a better fashion. So that's kind of where we're at with everything. I hope that provides a little bit of perspective to you all. We look forward to what's to come. Thank you for your time.
Thank you so much, Aldece. You did great. Thank you.